Is Dr. Botticelli? Where is he? There he is. Okay. So we have a new visitor, so I'll let Mr. Botticelli introduce.
Well, good afternoon, everybody. Thank you all for staying with us. It's been a long but really exciting day. So, I have to say the theme and focus of today is our particular sense of urgency in how we take research and move it into practice and policy, right? That's really been the theme of what we've been talking about today. And I know I'm a little biased, but there's probably no better example of that is how we move from research to enacting laws and legislation that continue to support our efforts in this area. And since I'm no longer a government official, I will take the liberty of saying that he perked up at that one, that in the run-up to this midterm election, it seems like everyone in Congress of late has decided that they need to write a bill and have a hearing to demonstrate to their constituents that they're paying attention to this issue. But we are very fortunate, and I say this with all genuineness, that our senior senator from Massachusetts is not one of those people. He's been a longtime champion and supporter of work around opioids for a very long time and has a track record to prove it. And we could ask, I have to say, we can ask for no better champion for people of this institution and for the people of Massachusetts than Senator Edward Markey. And he's also a Malden boy, so we know he has deep roots and humble roots in terms of the work that he's doing. So, lest I steal his thunder, I just want to give you a less than exhaustive list of some of his achievements that he's been able to make in Congress that specifically affects the work that we do in this institution and the work that happens around the country. So, first and foremost, he championed legislation to allow nurse practitioners and physician's assistants to prescribe buprenorphine. And I think, as we've seen in our presentations, the gap between the people who get on a medication is partly driven by the lack of providers who we have to prescribe it. So we clearly have to make sure that we do that, and that legislation will go a very long way. Supporting lifting the cap on the number of patients that a physician can treat from 100 to 275. We talked today about the challenges, Nora talked today very dramatically about the challenges that we face in terms of detecting and interdicting fentanyl that's coming into our supply. And through the work of Senator Markey, he introduced and passed the Interdict Act, and it was also able to get significant resources to increase our capabilities to detect fentanyl as it comes into the United States and comes through our mail system. We know that this is a significant opportunity where we have to reduce the supply of fentanyl and driving down overdose deaths. He helped champion the 21st Century Cures Act, which got $1 billion, desperately needed funds, to the people of Massachusetts and nationally to help us fight the opioid epidemic. Probably, at least for me, is best known for his vociferous protection of the Affordable Care Act. Completely understanding that eviscerating the Affordable Care Act was antithetical to providing treatment for people not only in Massachusetts, but in the United States. I think you all know that we could not do the work that we do here in Massachusetts were it not for the fact that just about all of the people in Massachusetts have health care coverage, and particularly through Medicaid and Medicaid expansion. So we really want to thank him for his efforts to defend that. And as we heard many, many times today, providing and mandating that prescribers have some modicum of education on safe and effective opioid prescribing has been a long-time passion of the Senator in terms of the work that we're doing. So, it really gives me great pleasure to invite him up to say some comments, but to also, on behalf of everybody in this room, to say thank you for the work that he has done and the work that he will continue to do in looking out for the most vulnerable people at a critical time in not only our history, but our nation's history in terms of how we treat the most vulnerable people in our society. So, Senator Markey.
Thank you, Michael.
Thank you, Michael, so much. And as you may or may not know, the reason he mentioned Malden is that Michael lived in Malden for 20 years. So there was one Malden person introducing another Malden person. And it's my honor to be here with Michael and with all of you for everything that you do on this issue. 33 years ago, last week, I met my wife for the first time, and it was an interesting date because I was an Irish Catholic politician from Massachusetts at that point, and serving in my 6th term in Congress, and I meet a woman who's a researcher at NIH working at SAMHSA on substance abuse and mental health issues. And she's a commander in the public health service, which she's joined after graduating from finishing her training at Stanford Medical School and then getting a degree at the Kennedy School. So now she's joined the public health service. So I've met her, which is kind of interesting, as she's explaining to me the interaction between mental health and substance abuse and the stigmatization of both and the need to destigmatize. So that was a date 33 years ago that I had. And then 30 years ago, next month, I married the dream. I married a Jewish doctor, okay? So that's what happened to me. So I've been getting the lecture for 33 years in substance abuse, and mental health, and their interaction. And she retired as a 2-star admiral in the public health service, and President Clinton named her as the head of all women's health for the country and the first deputy assistant secretary for women's health in America's history. And amongst other things, she created 10 centers of excellence for women's health across the country, including the one that's over at the Brigham that she created. So just to say, I've been a wholly owned subsidiary of your movement for my political career, and so I thank you all for everything that you do. And Michael, you were not only the drug czar for the nation, but you were also a treatment titan for the nation, pointing people towards treatment as the correct way to look at all of these issues. And the Graken Center is now going to be the foremost place in the country where experts gather together to try to solve these problems with Boston University Medical School, with all of the incredible professionals who are here, all working together in order to try to find a pathway towards reaching a day where children have to look to the history books to find if there ever was such an epidemic that hit our country. And we know much of it was preventable, but the medical profession and the pharmaceutical profession actually allowed it to happen. And so now we must put our efforts together. And while it is my 42nd year in Congress representing Massachusetts, after 37 years in the House of Representatives and 5 years in the Senate now, it's good to actually be introduced as the junior senator from Massachusetts. Junior, it's good to hear junior again, okay? Which is who I am in our delegation. But this leadership, this expertise which you all bring is needed now more than ever. The tsunami of fentanyl overdoses here in the state of Massachusetts is going to be highly predictive of what happens across the rest of the United States. Facts are very simple. 1 kilo of heroin cost the drug gang $6,000, and they can sell it on the streets of the United States for $80,000. 1 kilo of fentanyl cost the drug gang $6,000, and they can sell it on the streets of the United States for $1.5 million. 80,000, 1.5 million. And so they are rational political actors. So they have moved rapidly towards fentanyl. It's 50 times more dangerous, obviously, than heroin, but we should just expect there to be a continued acceleration of that market penetration by these gangs in the use of fentanyl as it's mixed into every possible concoction which they can put together. And last year in Massachusetts, it reached 80% of all of the toxicology screens in a deceased overdose victim found that they had fentanyl in their system, 80% last year in Massachusetts, and there's reason to believe it's actually increased this year as well. And so we're going to see that occur, not only here, but across the rest of the country. We're only 2% of America's population. About 1,750 people died last year in Massachusetts with fentanyl in their system. But if you multiplied that by 50, which would be the whole country, we're only 2%, you can see that you're looking at 70 to 80,000 people would have died last year with fentanyl in their system, approaching 2 Vietnam Wars in a year related to that one substance. So we're not there yet. We're 3 or 4 times worse than the rest of the country when it comes to fentanyl, but again, they are, it is moving rapidly, and we have to ensure that we have a set of preventative measures that we put into place. Earlier this week, a Journal of the American Medical Association article reported that fentanyl has surpassed nationally prescription opioids as the leading cause of opioid overdose deaths. So while the rest of the nation is not as bad as us, it has now clearly surpassed what was the epidemic just 3 or 4 years ago. So it's a crisis, it's a scourge. This is a human tragedy unfolding every day in homes, in alleyways, in bathrooms, the back seats of cars in every city and town in our Commonwealth. And you know as well as anyone else that the fentanyl crisis is likely to get worse before it gets any better. I wish I could stand up here today to tell you that the federal government is doing everything possible to combat fentanyl overdoses and address the opioid crisis, but there is so much more that we can do and we must do. We have made some progress over the last couple of years, to be sure. In 2016, Congress passed the Bipartisan Comprehensive Addiction and Recovery Act, known as CARA. That law included a provision that Michael made reference to, that I authored with Kentucky Republican Senator Rand Paul, that expanded access to medication-assisted treatment by allowing trained nurse practitioners and physician assistants for the first time to administer the life-saving treatment Suboxone. So we'd have more places that could be relied upon to provide the right treatment. So I was successful in getting that done. And following the lead of BMC, my provision is helping patients gain access to life-saving treatment throughout the country. But CARA was not funded when it was passed. And I think we all know in this community that a vision without funding is an hallucination. Saying that you should do the right thing, but not providing the funding is in fact, in many ways, worse because you have identified the problem and yet you refuse to provide the funding. So in March of this year, Congress passed a very large budget bill that will finally provide an additional $3.3 billion to our cities and states to support improved surveillance, more research, state grants to combat the opioid crisis through prevention, treatment, and recovery services. The new resources combined with existing spending mirror legislation that I introduced with Pennsylvania Senator Bob Casey that calls for the type of sustained investment over the next decade and that funding couldn't come at a more critical time. In fact, inside of this bill that we just passed, we also authorized, not appropriated, but authorized $3.3 billion more for next year, which would be $6.6 billion. Now, you multiply that by 10, and you're talking about $33 billion, but we know the number is $45 billion, it's $50 billion, it's more, but at least now we have the right pathway that Congress is traveling in terms of the funding for these programs. It will be a lifetime for our communities that are desperate for help, and one of the top priorities will be to ensure that states get the resources that they are promised. And so we are going to have to battle to make sure that those resources are made available. The government spending package also included funding for a bipartisan law that I co-authored with Senator Marco Rubio called the Interdict Act, which Michael referred to. I had lunch with President Trump at the end of October of 2017, and he asked me to come in to talk to him about his trip to China, Japan, and Korea that he was going to take in November. I'm the lead Democrat on the Asia Subcommittee on the Foreign Relations Committee. So Corey Gardner, who's from Colorado, and I had lunch with him with General Kelly, General McMaster. So my principal goal, to be honest with you, in that meeting was just to make sure he understood that North Korea already had nuclear weapons, and if we took a preemptive nuclear attack against him, that it wouldn't wind up well for South Korea, Japan, Guam, and that many millions of people would ultimately die. So I was trying to convince him that this goes to behavioral medicine, that Kim may be homicidal, but he's not suicidal. If he attacks us, he probably will be dead later on that afternoon, and there's be no point for him to really attack us, so we should not use nuclear weapons preemptively. However, I also said something else that's, in a lot of ways, greater and a real threat is the Chinese sending fentanyl, through the mail into our country or down into Mexico, from which it is then transported up into our country. So when you meet with President Xi, I said, that should be at the top of your list, because if people were dying at the same rate as they were in Massachusetts, 85,000 people will die this year from fentanyl. And that's real, Mr. President. That's happening right now. And it's something that the Chinese government, in cooperation with you, can. But I also told them about this bill that I had, legislation, that provides Border Patrol agents with advanced technological tools and resources to help staunch the flow of illicit fentanyl across our borders. So you have to think of a handheld scanning device that looks like Game Boys that can detect fentanyl at our borders, at our ports of call, through the mail, just goes right through the packaging, right here at the South Postal Station, right, a few blocks from here. They don't have the devices that allow them to be able to detect whether or not it's just being mailed in and that they can find it. So I tried to persuade them that the best way to deal with this flow of opioids was to use 21st century technology and not try to build a 17th century wall as a way of keeping it out. A bag of sugar would provide, a size fentanyl would provide all the fentanyl for the state of Massachusetts for 3 months. Okay? So we better have the detection devices, looking at all of the different ways in which they would be trying to bring it into our country. So what happened was, in the Oval Office in January, just 3 months ago, the president signed my bill. And Ivanka came over to me and said, I just want to tell you how much my father enjoyed working with you on the bill. And Kellyanne Conway came over and said, I preached, so the president signed the bill. And we had Senator Rob Portman of Ohio, and Shelley Moore Capito from West Virginia. So the president only signs the bill with one pen. He only uses one pen. Obama used 37 pens. He used to hand them out like they were M&Ms to everybody who was there. But he only has one pen. So he said, who should I give the pen to? And Rob Portman said, well, it's Eddie Markey's bill. You should give it to him. So the president looks up, takes the pen, and he says, I can't believe I'm giving this to a Democrat, right? So he hands it to me. But you know, when we're dealing with this issue, it's the only way we're going to be able to solve it. We have to work together. It's not partisan. It has no ideology. It's attacking equal numbers of Democrats, Republicans, and independents across the whole country. And that was a very rare moment where he's signing a bill and handing the pen to a Democrat in the first 15 months of this administration. But I worked hard to try to create that atmosphere where we'd be standing behind him in his office in order to accomplish that goal. I had done the same thing, actually, in May of 2015. I went across the aisle over to Mitch McConnell, and I said to Mitch, Lexington, Kentucky, Lexington, Massachusetts, okay, same issue, and we're two of the worst states. If you and I write a joint letter to the Secretary of HHS and the Surgeon General saying that we want an opioid Surgeon General's report, the same as the smoking report of 1964, I think they have to do it. And I think they have to do it in a telescope time frame. So we put it together, Mitch McConnell and I. We sent the letter over. I called the Secretary of HHS. I called the Surgeon General. I told them the letter was coming, you know, and they said, well, you know, these reports, they take like 2 years, sometimes more. I said, I think it'd be great if you could get it done like in a year. That would be fantastic, okay? That's the level of urgency that is needed to be attached to it. And it happened, right? We have this document now that kind of lays out what the experts say is how we should be viewing these issues and how they can be resolved. But again, it just requires kind of crossing the aisle, trying to find the people with whom you can work. And so there is much more that we need to do. Michael made reference to this. But for John McCain putting his thumb down at 1:30 in the morning with uncertainty for us at 1 o'clock in the morning, the Affordable Care Act was saved. Here's the number. 2.8 million people receive their addiction treatment under the Affordable Care Act. Now, you pull away access to treatment for 2.8 million people under the Affordable Care Act in our country, and you wait 6 months, whatever problems we have now would have been multiplied so many-fold, in terms of the catastrophe that would befall our country. So we thank John McCain for that. But the votes that we had to take actually on the slashing by hundreds of billions of dollars of Medicaid funding in general are all part of a fundamental misunderstanding of how health care is treated to those most in need in our society. And so far, we've been able to fend it off, to prevent it from happening, but it's something that is going to have to be constantly monitored if we are going to be successful, because otherwise cutting of that funding would be like throwing gasoline on an already out of control fire in the addiction world. And so from my perspective, it was good that the president finally declared the opioid epidemic a temporary public health emergency, but we all know that this declaration should be made permanent. The administration needs to put policies in place to help get this crisis under control. Dr. Martin Luther King Jr., trained in his PhD in theology at Boston University, once said, of all of the forms of inequality, injustice in healthcare is the most shocking and inhumane. And millions of Americans suffering from addiction are experiencing an injustice that we can fix. More than 50,000 people have died from a prescription drug, heroin, or fentanyl overdose since Donald Trump took office. It is time that this and all future administrations are held accountable for addressing the opioid crisis. That's why I am introducing the Opioid Milestones Act. with Republican Senator Lisa Murkowski of Alaska. That bill will enact a national strategy to end the opioid epidemic in America by requiring the federal government to set tangible benchmarks for how we are addressing the opioid crisis in our country, and by measuring progress on key objectives every single year. And these objectives include reducing overdose deaths, expanding treatment availability, increasing the number of individuals in sustained recovery, and decreasing emergency room visits for overdoses. We need to start measuring our progress, or we will continue to fight the same battle over and over again using anecdotal evidence. We have to be serious about doing this in the best possible medical way. When a person is sick, they need a treatment plan. The United States needs a nationwide treatment plan for fighting the opioid crisis. We urgently need to know whether our policies and resources are being used in ways that have a measurable impact on the public's health so that we can adjust accordingly. My legislation will provide a national roadmap for ensuring that our federal and state resources pay life-saving dividends. This type of strategy was put in place to fight the HIV/AIDS epidemic in America, another disease that was surrounded by stigma, inaction, and lack of research until advocates, scientists, healthcare providers, and policymakers joined forces to chart a path forward and make measurable progress. And while the war is not yet won, new HIV diagnoses and deaths have declined dramatically over the past 2 decades in the United States. When America has a plan, America wins, and we need one that is understandable and accurate to fight this war against the opioid epidemic. We need to continue efforts to expand access to treatment. I've introduced legislation to increase the impact of my 2016 treatment expansion law and make permanent and expanded list of healthcare providers who can offer medication-assisted treatment. We need you to continue your research on addiction and inform us how we can best care for individuals with substance use disorders so we can put them on the path to recovery. People here in Massachusetts and everywhere across the country are counting on you to continue to be the leader. In many ways, Massachusetts has been patient zero for the country on the opioid epidemic. But that means we are positioned to be the leader in revolutionizing the way we treat and manage this deadly epidemic. Other states look to us to establish their own guiding principles. And that's why I am so proud to be here with you today. I raised with Michael just before we started an idea that I'm working on right now that there would actually be an opioid warning on every bottle of anything that has an opioid in it that is clear and easy to read, not hidden in the box on a piece of paper or in some small type that is indecipherable for a person who is looking at it, but something that is just staring at families, at individuals as they are looking at it. So I want to, if any of you have an interest in that issue, I would love to get your views on whether or not you think that makes sense and how you would establish something like that that could be put across all products that have opioids in it, because thus far, I don't think most people fully still understand what the consequences are. So I want to work with all of you in your shared goals of becoming the leaders in the country. And the Graken Center, Michael, BU Medical School, all of you working together, Kate, the great Kate Walsh, all sitting over there, all of you just such tremendous leaders in our country. And I just want to let you know that I just try to take what you say on an ongoing basis, what I read, what I hear about here in Massachusetts, in the same way I did with the Affordable Care Act, and try to implement it. When we were doing the Affordable Care Act, it was Henry Waxman and I sat next to him in 2009 when we were drafting it on the Health Committee in the House. We were the two senior guys on the committee. And all people just kept turning to me and saying was, how do they do it in Massachusetts? How do they do this? How do they do this part of Massachusetts? How do they do this part of Massachusetts? So I know because I was in the room as the Affordable Care Act was drafted, how much of it was based upon what you were able to help to create, and the same thing will be true in dealing with this opioid crisis. Thank you all so much for everything you do. Thank you. All right. Michael wants me to take a couple of questions. Michael wants me to take a couple of questions. Yes. Anybody?
Barry.
The Celtics in 5, okay? That's the answer to the toughest question. Yes, sir.
This isn't so much a question. I just wanted to ask you to thank your wife for us.
Honestly, all right, I will tell you this little story. So, yeah, it was the middle of January, and every night on the networks, there was a story about young kids dying from this flu this winter, and older people dying, in much higher numbers than we've seen in like a decade. So she said to me, there's no dedicated program at NIH to find a universal flu vaccine. Do you think you can put $100 million in for a dedicated program? So I called Tony Fauci at NIH, a good Holy Cross graduate and a pal of mine, and he said, yeah, I don't have something that's large enough and dedicated enough. So in the budget that just got signed, $100 million for a dedicated universal flu vaccine program to begin research and apply immediately for that research money, please, at BU and at BMC, okay? So I'm just a wholly owned subsidiary. I'm told what to do. But with that, I work with a Republican senator from Missouri to accomplish that, right? You just have to try to work hard to find the way through on these issues. So thank you, sir. Anybody else? Okay, no questions, just praise for my wife. Okay, so I will take that home to her tonight. Thank you all so much. Appreciate it.